Good afternoon, everybody. My name is Scott McGann with the Falmouth Health Department. Today's March 25th, 2022, doing our weekly COVID-19 update. Our email is health@falmouthma.gov. Our phone number is 508-495-7485. And we still have a COVID tab at falmouthma.gov. Right at the top when you go in, and I put this information, I'll put this presentation in as well. We do that every week. We're at 4,011 cases as of yesterday. 16 confirmed for the week, 2 probable. That does not count home test. And I want to talk, I guess maybe this is a good time to talk about it. Case counts aren't really all that relevant right now. The majority of testing is probably most likely home tests. So take it with a grain of salt when I tell you about case counts, only because I don't know. And the only thing we can use is sort of like what's the schools getting for self-reports on home tests to sort of figure out if I've got, let's say, for example, 2 school cases that are PCR, but there were 6 reports total, then I know, and that's relatively consistent, then I know there's 3 times as many positives roughly than what the PCR is telling me. Don't really have enough data yet to tell you that, what the number is. Well, I'm going to try to keep an eye, I'll keep an eye on that. We'll just sort of, and that'll kind of give us a ballpark of what's going on. That's a pretty good indicator. But that's, again, these are confirmed PCR cases. Home tests do not make the system, so they don't, and that's kind of where we've geared people towards. So the case counts aren't as relevant right now. It's 16 confirmed. There is some number larger than that, total number of cases. Our 14-day daily incidence rate, which is, again, based on PCR tests, is 6.4 per 100,000. And Falmouth's positivity is down to under 2, which is a good number to have. That's a good number. It's a solid number because that's just the number of PCRs and the number of positives. And that being under 2 tells you that they're in pretty good shape with positivity, that you're doing fairly well. So again, these are PCR tests. We're real low. We've had like 4 consecutive weeks of low. Don't know where that number falls for actual numbers if you, again, with the home kits. Flattening the curve piece, again, the closer the dots are and the flatter the line, the better we're doing. And according, looking at PCR only, then we're doing fairly well. Barnstable County, again, PCR cases are dropped way off, similar to where we are. We follow that pattern. We're part of that pattern. Statewide, it's gotten a little bit higher. I'll show you when I show you the trends. We were at 1,000 cases. We were down around 600, 700, 800 cases before. It's a little bit, positivity is a little bit higher. There is a new variant. It's not a concern yet. It's, Omicron's, cousin. The deaths were 5. Positivity was under 2 for this 7-day time frame. But if you look at the trends, you see slight flattening, maybe a little bit up. We'll have to keep an eye on it. I don't think it's going to necessarily end up like where the original Omicron back January was. It's just, you just keep an eye on whether the cases are starting to increase. Hospitalizations look relatively flat, and so does the deaths. But you can see with testing showing a little bit of an uptick. I think they were down as low as 1.8 earlier. And cases are a little bit higher. It's not quite, I wouldn't say it's quite a trend yet, but we just, again, keep an eye on it. And I'll talk a little bit about the different variants in a little bit. Incidence rate with Falmouth, right in the middle. The state for that particular time frame was 9 for an incidence rate. We're 6.4, somewhere in the middle for the county. Percent positivity, again, right in the middle, 1.81. The state was 1.7, so very similar for our percent positivity. What we really want to gear towards now is looking at, the effect of COVID on hospitalizations and the severity of the burden of the disease. It's not as much about case counts anymore, especially if it continues down the path of being generally, especially with vaccinated population, much more mild than, in 2020 without a vaccine. And so we look at it now for a case count per 100,000 in the county of fewer than 200 or 200 or more, and the numbers of which the admissions per day is less than 10 per 100,000 for a 7-day total, and the percent of staff inpatient beds occupied by COVID patients less than 10%. So right now, we're in the low of the green category. So again, the 200 number, we're at 53.05. Our COVID admissions per 100,000 is 3.3. 10 or higher is high, is getting higher. And percent staffed is 1%, 1.1%. So though going back up, 1.1% is much less than 10%, and 3 is definitely less than 10, and we definitely have fewer than 200 cases, so therefore we are in the low. And this to indicate, this uses, the severity of it, not just case counts, and case counts, again, aren't really going to be fully known. But, we're definitely lower. But it does throw off the total number of cases, because again, it's dealing with PCR. But again, hospitalizations and the severity of the burden of the disease is definitely, the severity is what we want to look at. And that's where we are. So that's kind of gearing where we are now looking at it, as opposed to just total number of cases. Again, low, medium, and high. You'd be considering some mitigations like masks in schools and things of that nature when you get high, which would be some number, 200 cases and, over 20, greater than or more than 20 per 100,000 going to the hospital, and having more than 15% of your beds occupied by COVID patients. When you get into that, then we need to consider further mitigation. Again, this is CDC. Usually the state would, the state is where we get our guidance. And the state hasn't essentially adopted or told us one way or the other whether they're going to adopt this thing, and I don't know, if they're going to come out with their own metrics. So whatever, when I don't have something for the state, I refer to the CDC, and right now that's when I guess we'd have to start thinking about it. Our vaccination rates, we only gained 45. That's the lowest number we've seen in a while. We had 2 first doses, 8 second doses, and 35 boosters. But we're hitting the sort of that saturation level where you've got plenty of opportunity. There's plenty of vaccine around, plenty of opportunity. So, you have the choice if you want to get one, probably easily get one in the next hour or two after, watching me on this. This is a chart I show every week. This is what happens to people that are fully vaccinated when they get COVID. Of the entire population, 8.6% of people who've been vaccinated have had COVID since they've been vaccinated. Hospitalizations well under 1%, and well under 1% for deaths. If you were a person who did get it, you were one of the 459,123. 7,716 were hospitalized, which is 1.68, exact same number as last week. That number sort of leveled there to 1.5 to 1.7. And 2,222 deaths among vaccinated, which is under 1%. So that tells you the vaccine's highly effective, and that's where we are with that. This is what I wanted to show you. This is the chart I had showed you a few weeks back, when maybe a couple months back actually, when in orange is Delta and in purple is Omicron, how quickly it took over. So you see the chart right before Christmas. In Christmas, it's Omicron's dominant. By the end of that month, the end of January, it was almost all Omicron. Then you see the Omicron's cousin, the BA2 in pink. You see that sort of taking over. But you're not seeing, like a surge like you would see, with hospitalizations and so forth. You're seeing a bit of an increase in cases, maybe it's, a bit more, but not of a concern where, again, the hospitalizations and all that other stuff. So that's where we are with that. You can get this off if you want to interested. This is on the CDC's website. Vaccine availability, still, again, vaxfinder.mass.gov. Nothing's changed there. Homebound can still call the health department. We can get the VNA out to do a vaccine for you. Again, testing, hospital, convenient MD, pharmacy, home tests. That's your main places to go. We're not using the Cape Cod Church or the fairgrounds at this point in time. There just was not anybody coming to it. So the other thing to mention would be face coverings. Nothing's changed on that. The Board of Health voted to lift the mask advisory on May 7th. The school committee voted not to implement a mandate back in February. Select Board also lift the mask requirement. There are no requirements. Again, you just kind of keep, go with the ebb and flow. When things are good, you don't have a requirement. And when things are bad, have some requirements. So that's where we are with face coverings. And as a recap, case counts were consistently, I wrote that real quick right before I came up, consistently low sorry about that. I wrote that real quick and did look at it. Though true case counts are difficult to know with the home kits. Whereas CDC green, based on the burden or the severity of the disease, the hospitalizations. There's plenty of vaccine and testing capability, and there's no mask mandate. So that's kind of where we are with it. And so that's my recap for the week. We'll take the decent week, and we'll go from there and see everybody again next week. Thanks.